As we all know, the struggle we face and the strength we discover in our day to day life. Mental health is the only foundation to it. We all fail to acknowledge it and address it.
Indian stars like Honey Singh, famous actors like Amitabh Bachchan, who had issues with anxiety and depression at the brink of his lowest part of his career. Many famous heroines, many famous sports persons, all have accepted that they face some mental health issues. But these stories of struggle also shows the resilience and courage and the transformative power of seeking help. In this episode of The Healing Walk, we are joined by a psychiatrist who will take us on a journey to understand how we too can rewire our minds and rebuild our lives. From overcoming the childhood trauma to the mastering techniques that enhances the focus and self-esteem. This conversation will give you the tools to not just survive but thrive in the year ahead. So, as we step into the 2025, let's embrace the truth. Mental health is universal and healing is possible. Whether you are seeking peace, purpose, or just a way forward, this podcast is your guide to unblocking the power of your mind. Stay with us. Your new beginning starts now.
Hello and welcome to my podcast, The Healing Walk. I am Dr. Suman, your host. I have a guest on board who is a very well known psychiatrist. More than a psychiatrist, he is a very good friend, he is a very good mentor, and he is a person who always carries a lot of positive vibe around him. Let us welcome Dr. Amrit Pattojoshi, a renowned psychiatrist. Hello, bhai.
Hi,
Thank
Suman.
you. Thank you for coming.
Come on, it's a pleasure meeting you and sharing some ideas.
In fact, we are actually meeting after many years. Last we met in Bablu bhai's house.
It's been years.
Yeah, I think 3-4 years maybe. Yeah, yeah. I remember during our college days, after you passed your house surgeon, everyone else were kind of, they were kind of, I'll write All India PG and all that. But I remember it very, very particularly that you were fixed at your idea that I want to be a psychiatrist. I want to do it in CIP Ranchi. How that came to your mind?
Basically, I never wanted to join MBBS. So it's because my mom wanted me to be a doctor. And unfortunately, first chance I got medical and engineering. I was made to choose medicine. But I thought if I am made to do something, let me enjoy it. And from the very beginning, I was never somebody who is into cutting, be it the anatomy classes or the biochem, the physiology bit thing. I would never like to, the injury to people was something which was not, I was not very comfortable with that. And I always thought that it's the mind which controls the body.
Yes.
It's not the other way around. I saw a lot of people who are in pain but were able to overcome the pain. I saw a lot of people who were not too much in pain but because of their mental setup, they would succumb to pain. So I always thought that if I want to continue in this profession, I would become a psychiatrist. Now, psychiatry was a very small subject at that time. It was a subject which the last people, some people who did not get
Yeah.
it to take. So psychiatry as a branch never grew except one or two places, and one of them was Nimans and one was CIP.
CIP.
Because I never wanted to leave my state. I always wanted to come back, work in my state. So I thought that CIP is the best thing because you see more patients who are near to our own homeland. The culture, culture plays a very important role in mental setup. The most important thing is language.
Yeah.
You go to a South Indian place, the language. By the time you learn the language, your degree is already over.
Yes.
So I thought the best place is CIP. I'm near my home.
Hindi is
And
the language.
I learn a lot of things from there, and I can see a lot of patients from Odisha, and I think it was a bit of struggle, but then it
That is one of the best institutes of
was a
psychiatry.
top two institutes when
Top
I
two.
was studying in the country.
So, what are the challenges? Like routinely, I'll tell you. Suppose from the morning, patient comes and tells, "Sir, I have pain." Another patient will come, "Sir, I have this problem." By the end of the day, uh, we consciously or subconsciously we are actually we feel the pain. So similarly, for dealing with mental health issues, dealing with psychiatric issues, do you or the psychiatrist really they have any kind of issues that they face?
A lot of people ask me this question, sir. I heard the problem of one of my friends or my kid or my dad, and I'm feeling extremely overwhelmed. How do you manage to see 100 patients and yet remain cool? I enjoy my profession. Number one, I'm in a position where I'm able to help people, ease their pain. And the most important thing is to understand the pain, to feel the pain. But that does not mean that you become injured.
Yes.
So your own stability is the most important thing. When somebody comes to you with their problems, he or she needs to understand that you are understanding what he is or she is trying to emote. You are able to understand the pain they carry. Along with it, you should not act injured. You should be that force who imbibed all the things and gave a lot of positive energy to the
Positive
patient.
energy.
It's very important. And if you're passionate about things, you might seem casual, but if you're passionate and you're able to give results day in day out, you naturally feel good about your profession.
Yes.
And at the end of the day, you feel better than what you are feeling at the beginning of the day. I always
Exactly.
tell, if you are in a profession where you're able to do such a lot of good things, at the end of the day, you are happier, you are fresher, and you are cooler.
I'll tell you a very nice incident. In fact, today morning I met one guy, Sumit, and he asked me, "How do you see this every day? You must be seeing patients of cancer, and how do you manage that?" Then I tell I have a different perspective. Like every day in my clinic, I will see one or two patients whom I have treated maybe 5 year back or 8 year back, and that gives me the positive energy to treat the next patient. That yes, I can see this patient also getting cured. So the in fact what you said, that's quite relatable in
And
our
you are working in a much tougher profession.
not
You're seeing death.
exactly.
People are fighting with death. That's not a very great thing. It's tough.
Not exactly.
It's
Scenario
tough.
are
It's
kind
very
of
tough.
changing, but yes, we have to be mentally tough. And in fact, as you told, when we love our profession, we get acquainted to that, and that
And we
is
need to learn
how
to dissociate also.
exactly.
We can't be too much into things that when the next patient comes, you're not already out of the first patient. So the ability to focus, get out, and refocus is, I think,
Do
very
you
important.
ever carry the your clinic's scenario to your home, like after or coming out of the
Maybe
clinic? Do you?
once in a couple of years.
Hmm.
Otherwise,
Anything you remember such any incident?
sometimes, when you know that you could have done better, you have missed a small point which you should have been able to catch.
Yeah.
Maybe once in a while we lose a patient to suicide. That's when you feel that maybe you could have done better, even though you have given your best. We're human beings.
Yeah.
And with the load which we have, with the number of people we see, with the lack of information we get from the guardians, many of the things are hidden. People don't treat properly. In spite of everything, sometimes you need to take the responsibility of something happening, not happening the way you
Why
want it to.
still people have that idea that going to a psychiatry is still a stigma?
Again, there are a lot of factors associated. If you look at that, why there is stigma? Number one, if you look at an Indian family, there two or three priorities is getting the daughter married, getting a job for their son, and maybe people discussing good things about it. So if the daughter is has some mental illness, be it anxiety, be it a schizophrenia, anything, and they come to a psychiatrist, he or she is stamped. Nobody will marry her.
Yeah.
Number two, will you employ somebody who has serious mental illness in your clinic or in your OT? Or will you give a job when you know that somebody is mentally ill? No, you won't. Nobody will. I'm not naming you. I'm just telling you how the world is.
Yes.
So people hide things. So the more they hide things, the more it becomes bigger. And when it explodes, it explodes like something.
Correct.
Next thing is the treatment costs. Now, if you look at the health seeking behavior when it comes to psychiatric illness, because insurance does not cover psychiatric illness. Gradually it has started. But again, a simple thing like the patient had previous history of this makes the person not get any insurance. So the cost of treatment, because it is recurrent, many of the illnesses are recurrent because of whatever knowledge people have about the illness. So it becomes a very expensive affair. So you don't get a job, you're not able to marry properly. It is expensive, and many of the diseases don't have a one-time treatment. Suppose somebody has pneumonia, it get treated. And again, the profile of the patient. Somebody who has psychiatric illness, he might be a drug addict, he is a schizophrenic. The whole profiling of the psychiatric patients, you have a stereotype, or this is a psychiatric patient. Anybody who goes to the psychiatrist must be this. The typical profiling,
Profile is there.
stereotyping makes the stigma.
But nowadays it's like mental health is a different thing and psychiatric illness or
Again, I tell you, mental health is what everybody should be working on. And if you're not able to take proper care of your mental health, you might have a diagnosis. It can be anything. It might be a severe depression, to exam phobia, to somebody who is thumb sucking,
yes.
to nail biting, to aggressiveness, to excessive use of the mobile, to maybe impulsive behavior, to mood disorders in terms of depression, in terms of mania, to more serious illness in terms of schizophrenia, or maybe some addiction in terms of alcohol, cannabis, opioid, tablets. There's a wide range of things from which so you can't tell this is this, this is this. There are a lot of comorbidities involved in psychiatric.
Now what I mean is that people need to understand that this is this is a mental health issue for which the patient went to the psychiatrist and or this is some psychiatric issue illness that
First of all, you need to understand that anybody who has a brain might have a mental illness.
right.
Anybody who has a head can have a headache. Anybody who runs might have a pain in the leg. So the mind is working. If you look at 40 years back, people used to only do physical work. There's no question of mental work. Majority of the people are doing physical work. Now, if you look at the whole workload, most of the people are working from the mind. So naturally there will be fatigue. Naturally there will be wear and tear. And that wear and tear may come out as a depression, as an anxiety. And why do you worry about so much about things? There are treatments and there is recovery. And there are a lot of big people are working everywhere in the field, be it the Indian cricket team, to the Indian football team, to our judiciary, to our bureaucracy, to our politicians. A lot of people are there who are on treatment and who are doing very well.
Doing good.
Who have come out of treatment. So there's nothing to think about.
Exactly.
You don't need to delineate this versus this. Whatever is the problem, there is a solution. We'll attend to it. So
Some
no need to overthink on this issue.
some data says that one in every two persons or one in every four persons have some or the other mental health issues which impacts their daily life. Is it true?
Absolutely. If you look at India now, just look at your friend circle. Sometimes just sit down at home at night 10 o'clock, shut out everything, and just imagine that you have met 10 people today. How many of them were cribbing? How many of them were not happy? How many were complaining? How many were aggressive? We'll say 60 to 70% are not happy with their lives.
Correct.
That's a mild form of depression. A lot of people are complaining. A lot of people are aggressive. I'm telling that maybe in India, 60 to 70% of people have some issues. I'm not telling of a diagnosis. I'm telling
Correct.
issues.
Issues.
Which needs to be addressed. Why is India not a happy nation? We are progressing so rapidly. We have everything. Even your driver sits in a AC car now. Why are people not happy? Why are people so anxious? Why every friend wants to keep 50 crore rupees for his child when your dad did not keep anything for you?
Yes, yes.
The sense of insecurity. Why are people, we don't have friends around us?
We have more
Why we-
social media friends, but actual friends are less.
Life is changing. We are governed by what is happening around us than what we should be doing. We're running after shadows, and who's the real form we don't know. We're not grateful for what we have in life.
Exactly.
I have two hands that is working. Yeah, you work in a place where you know anything can happen to anybody anytime. You are the best person to understand. Everything is running smoothly. Next day somebody comes with a report and you know
Yes.
that life has gone to. So why are we not happy with what we have?
The same thing what you said, there is a book called Magic. There is one book called Secret, and its second part is called Magic. And that book is basically is about gratitude. Like what you told right now, we don't actually tell our or express our gratitude, and that is why we are not happy. If we express our gratitude, we are happy for what we have now, our majority of the problems will get sorted. And that's the gist of that book, in fact.
I think we don't have majority of the problems which we think we have.
We don't have.
We don't.
Exactly.
Let me tell you, because I interact with a lot of people and I have stopped interacting. I generally don't interact with negative people around me. I think I should be the positive man to have positive people around me. So the most important thing is acknowledging others' roles in your life. Acknowledging that we have achieved more than what we should have. And I tell to people that you don't get everything that you deserve. And you get a lot of things which you don't deserve. At the end of the day, it evens out.
Exactly.
If you plant 10 trees, you won't eat the fruits, but you are eating the fruits of somebody else who has planted the trees. So you need to, every night when you sleep, you need to thank somebody, be it God, be it your parents, be it your teachers, be it your patients, be it anybody, because of what you are today. And if you think you are not where you should have been, you need to try work harder.
Fine.
Efforts are in our hands. We don't have results. If you become result oriented, you'll always be sad. You'll be discontented in life. We as a nation, we as a generation are shifting our direction. The whole focus is shifting
That
from
is correct.
materialistic things, from things which we think will give us happiness, which never gives us, because those wants are never ending. It will keep on increasing. 5 crores becomes 10 crore. A 3 bedroom house becomes a 6 bedroom house. A
Do you
penthouse
think
becomes a farmhouse.
that's
That's how it
correct?
changes.
Do you think what you told, like expressing the gratitude, expressing a thinking about what? So now a lot of if we see the positive mindset books and all, there is a lot of things about habit forming. So, do you suggest some habits that can actually help in building or rewiring our brain for a good mental health outcome?
I tell you again, if you want to be really successful and happy in life, you need to be very disciplined. Discipline is the most important aspect in every, be it a student, be it a doctor. And what is being disciplined? Being disciplined means having the right habits. What is a habit? When you do things repeatedly. Suppose when I have a glass of water, I keep the glass on the table. It's
Correct.
a habit. When I enter somebody's room, I knock. When somebody gives me something, I tell thank you. When I get angry, I keep quiet. When I get angry, I shout. That's again a habit. So the more good things you do, because the more you do things like this, the less stressful the environment becomes. The better the people around you become. As a leader, if I shout and I'm angry, everybody will shout when I'm angry. As a parent, if I shout when I'm angry, my child learns only that thing, that when somebody gets angry, it is fair to shout or throw things. These are habits which we make. And once you make the habits right, the brain is in a constant motion. There is neuroplasticity in the brain.
Neuroplasticity.
So the rewiring occurs because the right things becomes automatic. Like I tell my students, from the very first day, you know how to examine the patient. Every day if you go and just see the pulse properly. During the exams, you don't have to, it becomes automatic. It becomes a
Automatic.
spinal process. You don't have to use your brains anymore to do the
Exactly.
right things.
Correct.
Like if you have learned the surgery properly, if you have learned to give the right medications, then you're just not stressful anymore because you have
Exactly.
learned to do the right things properly. You are at peace, your patient is at peace, your family is at peace. That's how the rewiring occurs. That's how the brain changes and you become happier and more contented. That's how I think habits help in forming the rewiring the
That's
brain.
the very right. In fact, one point that you told, that we shout and the child learns. In fact, Today morning when I was going, one car was there in front of that, another car was there. This guy was going on honking, and the child is there in the side, and the child will also learn the same thing, and that is what exactly happens. In fact, the kind of the parenting that comes into. Do you see these issues like the parents and children having a kind of a generation shift, and for which they still struggle to cope up with each other, and that's a cause of a mental health issue?
Absolutely correct. If you look at, I see a lot of children who come to me, and you know, parenting is the worst job in the world today. Damned if you do, damned if you don't. If you tell a child something, he or she remembers it, and they'll get back to you after 5 years.
And they will judge you.
They'll get back to you after 5 years and tell why you did it. And if you don't tell, they will tell why you did not tell.
Yes.
So tell the parents, damned and do it and be damned. So the most important thing is, we need to understand there is a generational difference. This is a huge difference between, suppose I have a child daughter who is 17 and a half. I need to get myself reintegrated into the environment they are living. They have a different lifestyle, We, the way of thinking, the approach to things, the way they handle criticism, the way they compare their wants, their needs, their dressing sense, their communication styles. As a doctor, when I entered the clinic, if there are 3 children who have come to me, they judge me with the dress I wear, the shirt I wear, the watch I wear, with the mobile I wear. The moment they understand that I am at par with their thinking, they open up.
They open up.
So many times people tell, why do you do all these things? I told, I don't need anything. And what happens is, a lot of people judge me. And if the parent comes with the child, they will not open up. But once they see somebody who knows some of the terminologies, who hears some of the songs they hear, who is comfortable with some curse words which they use appropriately, inappropriately, I will not comment. Somebody who has an Insta account, they understand that this man understands me. Because many of the times my father does not understand all this. Because the father wants to make the child as he was 30
As
years
you were
back.
30 years old.
I don't. I always tell, give them the value systems, give them the thought processes. Don't give them the dress. Imbibe in them the sense of how to take a decision. If there is a Coke bottle and there is a water bottle, you don't tell them don't drink Coke. You tell them what is in Coke, what is in the water. Let them take decisions. If I decide everything for my child, even if I take all the right decisions possible, my child will resist. There will be defiance. So don't try to take every decision of your child. Give them independence. Give them the a little leeway to fall down.
Yes.
Don't always hold hands with the child. Allow them little independence. Give them little respect. They need respect. They need to be told that yes, they treat you as an equal.
Exactly. Like from the childhood also, when the child falls down, we kind of go and hit the floor. That it is not your fault that you fall down. It is the fault of the floor. And the child also does not understand ki, yes, I can fall down and I need to get up myself. Those things, in fact, will come back in the future. And in the present day, with the so much of information that they kind of have in terms of the social media and the Instagram and all that, they are kind of overflowed with the information, and it is very difficult for the generation to match. And as you said, that the parents have to kind of go to their level and understand. In fact, I myself, sometimes I think, did I do this right? Did I do that wrong? When I shouted at this, is it correct? Now, in fact, I have kind of, I'm trying to, in fact, I'll not ask my son his marks. Because
So when I go to the parent-teacher meeting, I never discuss marks.
yeah,
I never.
because we judge them by the marks.
I asked the teacher, is my daughter well behaved? Does she listen to what you tell? Does she help people around you? Is she okay in class? That's good enough. So many of the parents are shocked when I go to parent teacher. We never discuss much.
In certain things, marks are kind of irrelevant. In like our time, it is you get medical or you get IIT or you get NIT or something like that. That is how people used to judge.
No, you have to look at the child holistically.
Huh.
You don't have to look at the child only in one part. I think I see a lot of people getting a lot of marks and the rest of the abilities are minus. So I want that the overall development and growth of the child should be that. The child should be compassionate, caring, respectful, should be happy,
Yeah.
should be hardworking, should be disciplined. A lot of things are there. Should have some extracurricular activity. Should be able to interact with peers and teachers. That whole thing is very important. Should be able to handle stress. Should be able to handle criticisms. Not take it too personally. I have the ability to tell. I should also have the ability to listen. That's what I think everybody needs to understand. As a parent, maybe because I'm a psychiatrist, I've been able to understand certain things and try to get those things into the system.
In fact, I had seen one of your interviews where you had said one nice thing that in the present day we don't teach our children to give, they learn to take. And when it comes to them for giving, that is where the stress actually comes. That's actually, and in the present day with the like YouTube and Instagram, the amount of screen time they spend, those things are also kind of distractions for them, and it's a big problem.
It's not just a distraction, it's a disruption in the whole life. Social media is playing havoc with the whole country, I think with the whole system. If you look at the average consumption of social media, I don't mean things which might help them. It's actually causing a lot of distress to them. Causing a lot of anxiety. It's causing a lot of stress, loneliness, compulsive behaviors, consumption of things which they should not be doing, normalizing a lot of abnormal behaviors. If you look at a lot of reels which come, the words they are using, the things they are showing, they're trying to normalize.
It's like they validate by number of likes.
Again,
That who has more number of likes, he is a bigger person, like that.
what actually Insta is doing, you feel inadequate when you see Insta. I always tell to people, Insta is for posting, not for seeing. Once you start seeing, you feel that you are inadequate. You feel that you are missing out a lot of good time in your life.
Have that
There are
FOMO kind
people
of.
who become depressed only by Insta. Sir, I have deleted my social media. I told, don't do that. You will delete and again you will try to put back. Try to be comfortable with that. Okay, that is
Accept.
only for posting. A lot of photos are, edited. A lot of things. People are going on trips just to show on social
That's
media.
not the real world.
Nobody is enjoying the moment. People are watching a cricket match. 5,000 people are watching. 4,999 are recording it. That does not give you happiness. Happiness is real time when you meet people, when you interact. That's the time when the hormones keep on. But what is social media doing? It's designed by behavioral scientists, psychologists. The only thing they know is how to hook you onto that. So you don't use mobiles anymore. Mobiles are using you.
Mobiles are using it.
Mobiles and tabs are using you. They keep you engrossed. The constant need of dopamine makes you check reels and reels and reels till you get one good reel and you get some dopamine. Again, every 2 minutes you have to look at the notification. My mobile notification is off for the last 5 years.
There is one thing called as popcorn brain. Like the moment we scroll it, it will pop. Again, we go to the next something interesting, again it will pop. So they call it as popcorn brain.
So that's what is happening actually. And the whole, I call it an anti-social media. I don't call it social media. Because social media, if you look at it, like we are there, we texted once in a while, we are in a group. That's good enough. We know that yes, Suman is there, I am there. We have not met in 3 years, but when we meet, we are connected. But this generation is always connected on the media, but disconnected in real time. You go to any party, everybody is with their mobiles. You go anywhere, it's just the mobile and themselves. And it's creating a lot of anxiety. People now are not able to interact in public places. So what they do, they go into their mobile. So because they go into the mobile, they're not able to interact. And because they're not able to interact, they're going into the mobile. So it's a negative cycle which is happening. Gradually, people are just holding on to their mobiles, feeling inadequate, not feeling good about themselves, feeling lonely. A lot of anxiety and depression occurs. A lot of people become suicidal because of all these negative things which gets pumped up and up and up as they.
I'll tell you a very nice incident. In fact, recently I was taking a cancer awareness program, and I was interviewing one of my old patients. So I asked her, Ki, when you were undergoing chemotherapy, tell me some interesting thing that you noticed. Then she told me, Ki, sir, once there was another patient who was there by my side, and when the patient came, there are seven people, his son, daughter, and all that. After 5 minutes, all of them were not there in the scene. They were outside watching their mobiles. This patient was lying alone with a gloomy face. And I was that time feeling that I am lucky that my husband is there with me, sitting and talking to me. And that's the scenario now. Another thing that I notice from this social media uses is people are actually are sleeping less, or this is watching mobile in the night, or having those kind of this popcorn brain or those things dicing up in our mind and giving us cyberbullying or something is giving stress and having a lot of effect on the sleep. Tell me one thing, how important is sleep for the for a good mental well-being?
I think three things are very, very important. Now, eating well, sleeping well, and exercise. Nothing beats these three. I think they come in the top of the list. Sleep is, I think, the most productive part of a life is the sleep part. And people think that sleep is just a resting stage. I'm not just worried about the hours people are sleeping. I'm more worried about the phase on which they are sleeping. That's very important. If you look at a normal individual, suppose I'm a little late sleeper because I come home at 10:30, 11. By the time I wind up, it's 12:31. I sleep at 1. Minimum 7 to 8 hours one need to sleep. So 12:31, I think current generation, I think that's the limit we should put it on. But what is happening is they're sleeping at 4 o'clock or 5 o'clock. When the problem starts, I tell you. Once you know that you're going to sleep at 4 o'clock, you tend to relax a little more. Suppose I'm talking about a student. He will go into the mobile more. He'll tell, "Arey, this time I can
Time
read
never.
more." So he gets into a lot of negativity. This phase when you are looking at the blue light or looking at the mobile, it activates your brain. in different
Amygdala,
cells.
basically.
Now you can't sleep. So suppose you go to sleep at 4 or 5. What time will you wake up? Suppose if you look at the average person, 7 hours of sleep. So somebody gets up at 12 o'clock. When you get up 12 o'clock, nobody is there around you. Everybody is working. Your mother is working, your father is working, your roommate has gone, your brother has gone. So the whole world seems a different world now.
Correct.
Now you tend to become lazy at this time. You tell I'll sleep little 2 hours more. And before you realize it's already 3 o'clock, 4 o'clock. Your eating pattern is gone disrupted. You have not taken breakfast, you have not taken lunch in time. You have not done exercise also. You wake up 4 o'clock, 5 o'clock, you start your day. Again that cycle goes to 4 o'clock, 5 o'clock. So the whole system, and you become alienated from the whole world. When people are returning from work, your day is starting. So you become despondent, you become low, you feel that you are missing out on a lot of things, you're not able to do anything, you procrastinate, you know that your job is not done, you become more anxious, more depressed. The whole cycle
Vicious
keeps
cycle.
on exaggerating, and then you lose a lot of things in life. So sleep is very, very important aspect. And sleeping at the right time, getting up at the right time is important. Many of the people have insomnia now. But I tell that if you have insomnia, you need to work on 4 or 5 things in your life. And I think that's good sleep hygiene.
Yeah.
First of all, whatever time you sleep, please wake up at a particular time every day.
Every
Suppose
day.
I wake up at 8 o'clock, even if I sleep at 3 o'clock, I need to wake up at. Because if I sleep at 3 and wake up at 10 o'clock, next day my sleep will be not at 3.
Correct.
It will go to 3:30. So that's how the whole sleep wake cycle shifts. So we'll not shift it. If I am sleep deficient today, I'll sleep little early next day. Number two, I will not, first of all, let us not take any alcohol, cigarettes, and all. That's a lot of people take this because they can't sleep. So any activating agent should be stopped after 6 o'clock or 5 o'clock. No tea, no coffee, no caffeine, no cold drink, no Red Bull, no, a lot of people are now going to gym, they take a lot of,
Even many people go to gym and do exercise in the evening, which is
again it
also
is detrimental.
detrimental.
Because they take a lot of caffeine. So pre-workout, we call that a pre-workout. A lot of people take pre-workout. Now, when you go to sleep, I think an environment, cool environment is very important. A lot of noise should be reduced. A lot of loud music should be reduced. Lighting should be a little better.
Hmm.
You need to not wear a jeans and a tank top and sleep. I think you need to wear a little loose clothes and go to sleep.
Comfortable.
Now, in spite of taking care of everything, you're not able to sleep. Don't remain in bed if you're not sleeping. And don't look at your mobile. Please shut down your mobile at 11 o'clock. Shut down your TV at 11 o'clock. If you're not able to sleep, I think you should have a corner in your bedroom with a chair and a bed lamp. Take out a book and read. I think one of the best methods to sleep is to read a book.
Read a book. Yeah.
And if I remember, I always read a book which is a little tough so that I get bored and sleep faster. People have stopped reading books. They read from again
E-books kind of.
e-books,
Hmm.
and that again activates.
Again activate.
So please don't do that. Have a textbook or a novel or any. You are talking about magical thinking. A lot of books are there nowadays. So you read that book. Once you feel sleepy, shut it down and go to sleep. So sleep hygiene is the most important aspect of your life. Once you have good sleep hygiene, you will eat well. If you eat well and sleep well, you will exercise well. That's all intertwined.
Correct. So having a good exercise habit in the, let us say in the morning, how exactly it affects the mental health from your point of view?
Like every patient who comes to me, I tell them to please exercise. Why exercise? Any mental illness has with it a lot of, you take medications. Now, medications sometimes increase your appetite. You might gain a little bit of weight. A lot of people are just on the hum of diabetes. You might precipitate a diabetes. You might have a metabolic syndrome. You might have hypertension. You might have hypertriglyceridemia. All these factors are one aspect. Number two aspect is the more, the factor you become, the more the area of distribution, the more amount of medications are required. Because the volume of distribution naturally increases. The more the medicines, the more the side effects. The most important aspect I tell is that, once you're physically tired, mentally you become relaxed. You just go and run for 4 kilometers. You might be panting, but your brain takes a break. But if you're mentally, physically not tired, your mental tension increases. A lot of good hormones.
Yes.
Good hormones don't pass. Again, when you exercise, your heart rate increases.
Yes.
Now, let us compare it with somebody having anxiety or a panic attack. What actually occurs in a panic attack or anxiety? Your heart becomes pounds, you have a little sweating, you feel a little restless. But why you feel overwhelmed? Because you know that you don't have any control. But once you exercise, your heart rate increases, your respiration increases, you have sweating. You know that after 5 minutes,
It will come down.
it will come down.
In fact, the resting heart rate in
Lot of
athletes is
athletes,
52. In my heart rate is 52. Resting.
90s, not an athlete. So that gives you a sense of control. Now, next time you have an anxiety attack, you have a panic attack, you know that this is similar to what I was doing when I was running.
Correct.
So in 5 to 7 minutes, this will subside. That's what happens. And once you exercise, you get into the positive sense of the world. Because I tell you, when you exercise, you know that I ran 5 kilometers and I burnt only 220 calories. I have a sweet that is 300 calories. Then you start understanding that to, burn this, I have to run this much. So you now have a healthy eating habit. Now when you do exercise, you also know that you need to sleep. So everything gets improved.
Correct.
So your mental well-being improves. When you feel stronger,
Again, you
when you feel
get up
healthier,
early.
automatically you feel better. And when you feel better, you also try to mentally take care of a lot of things in your life. That's all.
In fact, after we run, like every Sunday is my long run. So I run for 21 or 25 or something like that. So now Saturdays, any party or any evening is kind of stopped. So that also is a stimulus that you dissociate from your bad habits at
And you save a lot of money also.
yeah.
When you don't party, you save a lot of money.
So correct. And another thing, I'll tell you one thing. When I run usually, I have make a habit of wishing the other person. I don't know that person, but I will just wish good morning, sir, good morning, ma'am. And one thing I have noticed in them is that their expressions will change. So, like I feel someone may be having some stress, but if we wish them, we acknowledge them, their presence during that time, that also shift their mind from their stress to something positive. That's a good habit that I feel ki everyone should follow. Even when we are going in the lift, if we wish that person good morning or good afternoon, that person may be entering with a lot of stress. But after you say his expressions or his mind will shift a bit. So that's a very positive thing, and in fact, I have been following it from few months, and I have seen nowadays when I run, those people are like they will wave at me way ahead, like 100 meters or something. They will wave at me. If I don't come for a run for a week or so, next time, where did you go? Why didn't you? Why you are not here? So that's a very good positive vibe. In fact, people develop.
Great. That's great of you.
So, like mental health things, it's like more of counseling, or there is a threshold that at some point they will need medication. How is that decided?
I tell you, the awareness regarding mental health is still very low in our country. So, majority, I tell 99% of the people who come to us, you know, they've already crossed the threshold. They've already becoming disruptive, maybe disruptive to the environment, disruptive to themselves in terms of maybe being not talking to any people, having very low mood, a very elevated mood, being aggressive, suspecting people, taking alcohol for the last 5 years, taking cannabis in a great amount for the last 3 years. So somewhere, if there are adjustment issues, if there are small marital issues, there are little behavioral issues, we talk about counseling and then. But once somebody comes to us, when there is dysfunctional life now somebody is not able to focus on the family, the workplace is getting impaired. Again, I talked about disruptions. We need treatment. Now, treatment comprises of a lot of things. And I think in a country like India, in a place like Odisha or in a place like Bhubaneswar, which is a tier 2 city, where we don't have psychologists. You refer somebody to a psychologist is not available. Now, Indians are not psychologically that aware that a psychologist can really take care of them. A lot of people come from outside places. It's for them, they don't get access to all those things. Again, psychological counseling requires a lot of time. You need to be patient. It has to be constant. So what we do is with medications, you give psychological treatment. Medications, the advantage of medications are they act very fast. They're able to, because the patients when they come to us, they're at a level where they're almost not manageable. So we need faster recovery. We need quicker response. We need to get them back to normal very soon. So here medications play a very important role. And it's not that medications have to be given lifelong. There's a lot of stigma around medications. Why there's stigma, I'll tell you. Because the Indian society, the people think that giving money, a consultation fees to a doctor is a sin. It is automatic. You be however honest you can be, but the moment they have to give, they have an issue. So what they'll do, they'll take a prescription from you, and they assume that this medicine has to be taken lifelong. So why will we give 400 or 500 rupees to this doctor? There is a chemist who will give us medication. So they keep on taking those medications. And for a disease which needed 6 months of treatment, they'll come after 4 years.
Yes.
They've developed tolerance to the medications and they need higher medications. So maybe few diseases and a small percentage of them require 5 years or 7 years of medications. For that, I think 70 to 80% of the population is suffering. They're not coming to the doctors.
They don't come.
They're not coming for consultations. and the neighborhood chemist is making a hay out of. They're making a lot of money out of it. And so I always tell to people, let's not fight the medication, let's fight the disease. And the medications are only going to help you get out of the disease. If you have any side effects, we're always there. We're not those doctors whom you can't communicate, who does not listen. We're not that. We're very, very friendly. We've given you two telephone numbers where you can contact. We have WhatsApp, we can just send you a prescription, tell what is the issue, and we can immediately address those issues. Yes, every medicine has a side effect. Even if you drink 10 liters of water, you will have a side effect. So I tell them those are very, very safe. And if you have any issue, we're always there. So the whole stigma around medication, the whole lack of awareness about what these medications do is making people ask these questions.
Commonly.
I think medications are the best things possible for mental health issues.
You say that mental health medicines are better or counseling is better?
Come on, what is counseling? You go in an auto and you tell that I'm having this. They'll tell you, why don't you take this medication? Sir, you'll feel good. That is counseling. Anybody can counsel anybody. But when somebody has mental health issues, let us not trivialize mental health by telling that counseling will work. It depends on which stage the patient comes.
Yes.
What we tell to a lot of people become mental health specialists. You do exercise, you eat well. Come on, guys. When you go to, I always have this analog. When you are very, very hungry, your mother does not feed you with pickles and papad. Those are all add-ons.
Yeah.
So also when people come with mental health issues, counseling is not a solution. Yes, with medications, with specific therapies, counseling might be helpful. So depending on the severity, depending on the stage on which the person comes, I think we need to choose our treatment.
Recently, one what you call Netflix, there was a show of Amir Khan and his daughter Ira Khan with one Dr. Bikram Murthy of USA.
US.
So there, Amir Khan was telling about that yes, everyone should go for a therapy. I just want to understand exactly what does it mean by going for a therapy.
Listen, first of all, we are over idolizing Amir Khan.
No, I am not
No,
about Amir
I'll be
Khan.
very specific. I have to be specific. If you are specific,
Yeah.
Does he know how many therapists there are there in India?
Exactly. That's
Does he
what.
understand how many mental health people with mental health issues are there? Does he know anything? Giving comment like this actually does a lot of harm to the mental health professionals.
Now, what exactly therapy is?
It depends. Like I'll tell you, if somebody has obsessive compulsive disorder, if somebody has depression, we give cognitive behavior therapy. These are specialist treatments.
Specialist
Like
treatment.
somebody is having a thought that my hands are dirty. So if you have a thought in your mind that your hand is dirty, what will you do? You won't wash it. Now every 5 minutes a thought comes to your mind that my hand is dirty. I'm sitting here, I've not held anything, I've just washed my hands.
Yeah.
Then a doubt comes, while coming, did I touch him? I need to wash. So now a therapist will teach you how to resist this thought of going to the wash machine and washing your hands. If somebody has a phobia of lizards, now how does a therapy work? First of all, we'll teach him or her to draw lizards. Then we give him plastic lizards to hold. Then we give real lizards. This is how we are exposing somebody and not allowing them to run away from the situation. So therapy is for different disorders. If somebody is having depression thought processes,
It's like feedback mechanism kind of.
We tell them like suppose my teacher told me today, why are you late? I have this thought in my mind that teacher told me why I'm late means my teacher is going to fail me.
Okay.
So now the therapist will tell how many times did the teacher told you that he'll fail you, he's never done. So many people come late. Has he or her, has he failed everybody? So we make it evidence based. A lot of thoughts come to our mind and we accept it. And then we start, believing in those thoughts and behaving so. So we start challenging those thoughts. We need to reframe the thoughts. So therapy is different.
So basically, there is a process of the mental challenging or treating the mental health things, which involves the counseling, therapy, medications,
tell you a
everything.
simple thing, like an orthopedician. There's a fracture. I operated, I opened it. Then the physiotherapist comes.
Yes.
And does things. So everybody has a role. Now, if you tell that the bone is broken and the physiotherapist will work, it's not like that. Now, sometimes there's a strain. The orthopedician gives some muscle relaxation and the physiotherapy works. So based on the severity, based on the intensity, based on what is happening, there are different treatments.
So that counseling part is done by the psychologist.
Counseling
or
can be done by anybody, but if you
anybody.
look at therapy, it has to be given by a trained
Professional person,
clinical psychologist.
clinical psychologist.
There are courses for that, specific courses where they work with patients and all.
It needs a lot of patience. They have to hear everything and analyze and.
Yeah. You require a lot of patience, you require a lot of time, effort. It's a tough, challenging.
You mentioned about workplace mental health issues in the workplace. Exactly. What suggestion you would give for people to kind of tackle the mental health issues in the workplace? Because you may remember there used to be what you call Zoom meetings, and there was one video which was very viral, that one guy is scolding that if you don't do this, you are going to be thrown out. So I believe, yes, that guy also may be having a mental health issue of imposing something, and he may be having the pressure, and this fellow also will get pressurized. So how exactly a person can uh, help or tackle a mental health issue in a.
Now, there are different aspects to it. Now, as a boss, how will you handle?
Yes.
As a co-worker, how will you? As a team member, how will you work? Now, suppose I'm the boss and I have to manage a lot of people around me. I cannot treat everybody on the same level. A Suman is somebody who has a sick parent at home. He needs to be on and off. He will take 2 hours off, 3 hours off, but he will come and work. He will always compensate. There's somebody who is not working, but I have to make him sit for 9 to 5. Different wavelengths. I have
To understand
take care of.
every person.
I should not become vindictive. I should give them a chance. If somebody is having issues, I always tell to people, we make it personalized. The boss who tells that everybody has to be like this is not the correct boss. Everybody cannot be equal. But if I tell that if somebody is able to give his or her best, that's good enough for me. I think that's good enough. Now I'll have a lot of pressure on me. I need to communicate with somebody front to front, not to humiliate somebody. But if somebody is not able to, I know somebody is having mental health issues, I need to refer him. I need to have somebody in my office with whom people can communicate without being judged, without being talked about, without being. Now, in a team, sometimes I might have a very bad boss.
Yes.
One of the major issues when I worked with corporates, and I left corporate, working with corporate because I listen to the problem. When I talk to the solution, the management does not listen to.
Yeah.
When I tell this boss is bullying, this boss is victimizing somebody, this boss is abusing somebody, they don't listen because they don't. I thought I'm not an agony aunt. I am somebody who gives solutions. I cannot just be listening to problems. So what happens when you have a difficult boss and you know that you have no option? First of all, accept him.
Correct.
Adapt. Communicate. Tell that I don't accept certain things which you tell. You need to communicate also.
You have to say no whenever you have to.
You have to tell that no, sir. It's okay. I did not do work. It's okay, but you cannot, do like this. You cannot do like that. You need to also communicate. You also need to tell that, sir. You can tell me like this in a better manner. Like I teach a lot of parents how to talk to their children. So give them respect. As an individual, if you hit at the self-esteem of individuals, that.
Yes.
Yes. And now you also need to understand who is anxious, who is little depressed, who is having substance issues. A lot of people are having substance abuse. A lot of people are having family issues. A lot of people are living with people who are ill, who are sick. So a lot of things can occur. We need to be compassionate. We cannot just be driven by figures. And at the end of the day, how much money you are making is important, but it's not the only thing that we are living with. If somebody is not, for a period of 2 or 3 months, somebody is down, we need to cover him up. Suman has been a very good worker for me. For the last 8 years, he's been superb. Last 2, 3 months, I'm finding that he's not up to it.
Need to
I'll not
find
just
out.
take him out. I'll give him somebody who will just cover up some of the things. I need to communicate with Suman what is problem, where I can help, where as a boss I can help, and then gradually we have to take him out of it. So if we live for each other,
Correct.
if we cover each other's back, I think that makes a good team, and a good team always will give good results. So team effort.
As you said, like the corporates do have mental health personnel, but they don't actually. It may not be there in their policy to change or even those
Gradually
things.
people are
Yeah.
coming out, but I think it's more of a eyewash. It's more of optics than actually, you understanding that yes, today is Savitri Amavasya. I think the ladies need to take the second half. You
Yes.
please
Yes.
go.
Mm.
This is a marriage in your family. Please go. Attend. But when you come back next 5 days, I want you to work 2 hours.
Work this.
You will love working in a place where you can, take a 2 hour break or 3 hour break, have a lunch and come back and work 2 hours.
Yes. Yes. Yes.
I think that dopamine rush is important to people, not this scrolling.
How important is having a mental health person, like a psychologist, at school? And do Indian education system, that's not that commonly we see in the schools.
Tell you something. What is happening is we are looking at a Western model now. There's a lot of psychologists available in the market. Here we don't have a lot of trained people.
Yeah.
I think the necessity of having psychologists and clinical psychologists is huge. I think as a policy, we need to change. We need to make more colleges where we have psychologists, more clinical psychologists, because there are a lot of doctors now. If you look at psychiatrists, maybe 10 years back there was
Very
scarcity,
less.
but now I think the whole gap has been covered adequately. But what we lack is clinical psychologists. What we lack is counselors. What we lack is because they need to have the mindset. Everybody and anybody cannot. For me to counsel Suman, who is somebody in the top, I need to be in the same intellect level, or you will laugh at me and go away if I speak some nonsense.
Correct.
So I think it's very, very important to take care of our children. And I think teachers who are teaching in the primary level need to have a degree in psychology, maybe a 6 months training course or a 3 month training course, but they can actually address the psychological needs of children. I think we need to give out stronger children out to the society. We need to give us robust, we need to give resilient people out to our society, which we are not. We're just giving marks to our children. We're not making them strong.
I'll tell you a very nice anecdote that one of my guests in a podcast had told, that morality and the good behavior, etc., they are not taught in the school. For one reason is the parents think that it is to be taught in the school. For the teacher, it's not in the syllabus. So they have to cover the syllabus, where morality is not there in the syllabus. So ultimately, the child is deprived of being told, yes, this is correct, this is wrong, or you come and communicate if there is a bad touch, good touch. So those things are not
So
there.
I'll object to what you have told, if you don't mind. It's not telling them, it is you doing the things.
Yes.
I think our children are very, very sensitive and very intelligent. You can't tell something and do something. Children observe you. Suppose I am the man. How I pick up my phone, how I talk on the phone, how at 2 o'clock when a phone call comes from a patient, how I behave. Do I tell the patient lies? Do I tell somebody lies that I am not well, I am somewhere when I am not there? Am I shouting?
Correct.
When somebody has done a mistake, suppose I have an employee who does a mistake, do I shout at him? Do I treat him badly? There's a maid working in a house. How do I feed him? Do I take care of him or her? I have a pet in my house. I'm driving in my car and a cyclist comes. Do I just overtake him or do I wait?
Correct.
There's a blind man crossing the streets. Even though I'm late, do I wait? Did I ever get out of my car and there is somebody injured? Did I look at these things? The
Children will learn.
You can tell whatever you want to come on TV and tell. You can talk on a podcast, but it's not important. I studied in ICC school. We were taught moral science. We were told this is wrong, this is right. If I do this, God will not be happy with me. There was a lot of spirituality in it. Always tell moral science should be brought back to the syllabus.
Yeah.
People should know. Teachers, they also bring their set of problems to school.
Yeah,
They shout. They are angry. They also bully. They also compare. Your elder brother is like this, you are like this.
Correct.
What we speak is very important. How we speak is very important. When I am shouting at somebody, am I shouting because I am aggrieved or because I care for you? People will understand. When I am talking to my daughter that you need to study, it's not because when I stand in front of my friends, I tell that my daughter has got 95. I am worried that what will happen to her future if she doesn't study. Because I will not discuss marks with anybody. So that the children have to learn. The parents have to teach. Parents think that the teachers will teach, the teachers think that the parents will
Parental.
teach. I think it's bilateral. Everybody is teaching something. It's by our action, it's by our behavior, it's about what we do, what we think. And we need to give our thought processes correct. We need to give that to our children. We don't have to give money to our children. We give them the right education. When I choose a school, when I choose a college, I need to think about all these things. Not about marks or how big a doctor. You know, a doctor without a heart, a doctor without care, a doctor without compassion is zero.
Correct, sir. Correct.
So I think we need to be examples for our children. If I smoke, if I drink, if I don't do exercise, if I need to be that man who my daughter sees and tells, yes, that's my dad. The student will see, and that's how I want. My students want to be like me.
Yes.
My children want to be like me. That's very important.
We have to be examples.
And for that, we need to be either change ourselves or be what we should be in life.
Yeah. We ourselves cannot control our impulse to watch mobiles, and still we tell.
I will try to differ on your point. Now, we are not against mobiles. We are against what thing you are being deprived of because you are using the mobile. I come home after 15 hours of work and I take the mobile. That's okay. You cannot compare with me. Let us not become. But if you are in a function, if you are in a discussion and you are on the mobile, you are not focused on. That's a problem. But we also have a right to be happy. We also have a right
That's
to experience.
correct.
But then there's a limit to what we should be doing when we are around our kids.
That boundary has to be kind
Limit
of
setting is important.
is important. So tell me some techniques that you would suggest to improve the concentrations.
Suppose I'll tell you. Now we become very fickle. Every 30 seconds we need a new reel. Every 1 minute we need a twist. Every second day we need a new dress. So somewhere we become very distractible, and our attention has changed. So number one, mobile should be switched off for definite period. The most important thing is to
Agree.
just throw the mobile for 30 minutes. 25 minutes. I tell keep your mobile off for 25 minutes. Read something, do something, go back, take your mobile, do it for 5 minutes. 25, 5 is the ratio I always tell to people. So if you read for 5 hours, then think that you can do your mobile for
Half an hour.
yes, half an hour, 45 minutes, use it. Number 2, shut off your notifications. Number 3, start reading books, underlining books, reading, writing down. Number 4, crossword puzzle or a Sudoku. I see my mother doing Sudoku every night. That helps her improve her memory. Playing chess, where you think of 30 moves ahead, where you think of what happened last game. You read, those are very important things which one should have. Discipline again is very important. Sleep, appetite, exercise, very important. Distractions. You need to understand what you want to do. I'm in the class, for what reason I'm in the class. I need to focus on the teacher. I focus on. So the best thing is to write, to read, not from mobiles. Because the moment you read from mobile, you know that it is in the mobile, you can get it out anytime.
Yes.
But once you focus on the class, once you focus on the notes, you need to know that you need to memorize. You need to remember all these things. To remember all these things, you need to focus. You need to improve your concentration. So I think it's a healthy exercise. It's a process we need to develop in our life. Because I tell to suppose my doctor students that once you're in the casualty and a patient comes, if somebody comes with a stomach ache, which is chronic, he has read much more than you.
Yeah.
Because you have read about 1,000 things. You read about only one thing. So the moment you open Google, once you are gone. You need to be confident. For that,
Yes.
you need to have that residual knowledge, so writing notes, underlining, reading from books, very, very important aspects.
Journaling basically.
And once you read, you need to tell to somebody. Teaching or telling to somebody is one of the most important qualities one needs to have. If you're a student and if you have 1 or 2 friends, you can work together. And distractions, I think to be taken out of our lives. It's destroying our whole generation. It's destroying our society. If you look at the number one thing that is impairing productivity in India today, it is social media and mobiles. Next is pollution. The two things which needs to be taken care.
Controlled.
I think we need to make a movement of banning social media below the age of 14.
It's there in
Because
Australia, I think they have done.
I've been running after people to make it into a movement maybe. But below 14, I think we should be banned because they don't know what is happening, what they are doing. I see 1-year-old kid who don't know, 2-year-old kid don't know how to hold a pen can swipe better than you or me. So the first motoric movement of a child is now is this, not this, not this, not this. So now we need to re-ask, can he swipe? When you ask
Correct.
about a cerebral palsy or about development milestones, you need to ask, is he able to swipe?
Correct.
So I think distractions, if they are reduced, somebody is able to write and read. I think concentration for work, those are very important.
About the mental health awareness, what are the steps that are being taken or that can be taken for improving the awareness among people for mental health?
I think one of the most important issues that mental health is, you need to create a lot of awareness around what are the signs and symptoms. And as a professional, I have seen that the maximum resistance comes from doctors, not from the educated people and the doctors are the number one impediment to proper treatment of mental health issues.
Correct.
Because whenever somebody sees a prescription, he tells, why are you taking medicine? You don't need to take this medication. Not understanding what has gone through. Somebody who has surgery, why are you taking this medication?
We face that day in and day out in cancer also.
Neurologists writing medications, whatever the MRs have given, told them. Gastroenterologist writing medication. You write, I don't mind. I always think that if somebody is able to treat, please treat. But once you have started the medication, please refer to a psychiatrist. You should start, but then you should also refer to them. Now, somebody has blood pressure issues, I will write the first medication and tell them go to a cardiologist, go to a medicine specialist. Number two is it has to come under the insurance. If somebody with diabetes, somebody with blood pressure, somebody with cancer, somebody with cirrhosis can get, why can somebody with mental health issues? Number three is the stigma associated with it. Like I work in a medical college where we have already employed 3 people with serious mental health issues. Where my chairman actually tells me, Amrit, can we employ? Yes, ma'am. And we have successfully managed to employ 3 people who are doing good, very great work with mental health issues. Number 4 is we should understand that everybody can have a mental health issue. Everybody, you, me, my child. In spite of somebody having everything possible, people ask, why did it happen when I have given everything? My life was absolutely smooth. I have no issues in my life. So why am I depressed? I don't know. There can be no reason for somebody having a mental health issue. You don't try to find a reason. You try to find a solution. Because it can be from the childhood, something has happened. It can be your genetics. It can be the psychosocial milieu you have been. It might be your psychological makeup. It might be the stress you have handled throughout your life. At the age of 35, 37, where everything seems right, it spills over and you become depressed. So don't try to find a cause. We'll find a cause. But the most important thing is treatment. Again, you need to understand that treatment is not lifelong. Most of the diseases you have to treat for 6 to 8 months.
Correct.
And most of the diseases you don't need to sleep. We have 90% of the population working very well in society would be able to know. So a lot of myths about mental health and its treatment.
So take help whenever it's needed.
Treatment.
Be open.
It's not your fault that you have illness.
Yes.
But it's your fault if you don't take treatment.
Yes.
Because solutions are there. There are psychiatrists everywhere. Not a good trained psychiatrist everywhere.
It's like the same example that I give to my patients about cancer. Like cancer is a disease where your child steals some money. Mother knows that but doesn't tell that to father. And they will come to know about it when the same child will go and steal and police comes home. It's the same thing that even in psychiatry we face.
It's much worse.
So before we end, so it is now 2025 coming. So what's the New Year resolution of Amrit Pattojoshi?
I always work on myself because I always believe that if you are happy, you can make everybody around you happy. I always want to be the positive person in my environment. Take care of my clients, my family, my friends. And at the end of the day, I feel that one should be contented with what we have in our life. Yes, one resolution, I need to work on my fitness a little more. I've been a little you know, less, focused on my physical aspect. The mental aspect is good, but yes, I need to. After hearing you run for 21 kilometers, I think
42.
huh?
I have done 42.
You have done 42, yes, but but so I need to focus on my fitness a little more, and I've already started. I thought, let me not wait till January 1st. Let me start it by December 1st, so that when January 1st comes, I'm already into my resolution. Because when you want to do a good thing, you need to start today. When you want to do a bad thing, you think it will be tomorrow, day after, or day after. So that's what we are. You need to start something good, start it now.
Thank you, Bhai, and for coming. And it has been a great session we both had, and I'm sure our listeners will like it. One thing I would summarize about our present discussion is that mental health is not a disease that we should be afraid of. If we are having any kind of issue, we should immediately take professional help, and someone being treated by a psychiatrist or a psychologist is not a disabled or a diseased person. He can be completely a normal individual. We should not have any stigma for it. And another important thing is have a proper habit of doing proper exercise, proper nutrition, and have a good sleep. If you like this episode, please do like and subscribe to the podcast. Thank you very much.